Whether you're having fertility treatment or hoping to fall pregnant naturally, getting your body ready for pregnancy is something you should be thinking about ahead of time. As an experienced obstetrician and fertility specialist, Dr Jyoti is just the person to answer our questions about the steps to take before pregnancy. Hello, Dr Jyoti.
Good morning.
Welcome back to the podcast.
Thank you for having me.
One of the things we've been speaking a bit about on the podcast so far is all around fertility, but today I wanted to have a chat about obstetrics. Can you tell me a little bit about, if you're planning a pregnancy, what type of things should you be thinking about?
So when you're planning a pregnancy, there's a few things to think about doing. So just thinking about your general health and whether or not you should be taking a supplement like folic acid before you get pregnant. Ideally, at least for 3 months before you get pregnant would be fabulous. And then thinking about whether you have other medical conditions that might need to be optimised or change medications that are more suitable for in pregnancy or safer in pregnancy, and perhaps who you should be seeing to have a chat about that.
What do you need to take any supplements?
So I think you don't necessarily need to if your diet is adequate. You don't need to take a general amount of supplements. However, we do recommend that you take extra folic acid because it's easy to miss out in your diet, even though some foods are actually fortified with folic acid, things like bread. But we recommend a certain amount of folic acid per day, and that reduces the risk of your baby developing problems like spina bifida, birth defects in the spine, or other sort of birth defects in the head or the brain. So that's a very generally recommended supplement that we suggest most women take. And popping along and seeing your gynecologist or an obstetrician or your GP, if you feel confident to go and have a conversation with them and plan your pregnancy. They would test for a range of different blood tests, I suppose, including things like vitamin D and your rubella status, hepatitis, things like varicella, which is chickenpox, because some vaccinations can be given before pregnancy but not in pregnancy because they're live vaccines, and so potentially could cause a problem if you're pregnant. So this gives you the opportunity, if you are planning a pregnancy, to go along, be tested, make sure you're immune to some important infections in pregnancy, and have the appropriate vaccinations before you get pregnant.
If you want to do some pre-planning, who are the types of people you can speak to?
You can definitely speak to your GP. Most GPs are really comfortable talking about planning for a pregnancy, and the other alternatives would be to see a gynecologist or an obstetrician.
Yeah, I suppose that's not something you generally think of straight away, is it?
No, and obstetricians and gynecologists generally have a really good idea about what tests should be offered prior to pregnancy and then the journey that woman should expect through pregnancy. So they're good at actually explaining all the testing that can be available in early pregnancy as well. And sometimes women can be unexpectedly pregnant without a lot of planning. So then their journey might be to go to an obstetrician, and then the obstetrician, if they see them early in the pregnancy, can run through what's available.
Yeah, some of the things you mentioned earlier about that you could do pre-pregnancy, I suppose just give you a bit of extra comfort when you're during your pregnancy. Is that the intent?
Absolutely. I think it's also to not necessarily mean that those people have to do the testing, but also think about what those test results might mean to that patient or that couple and how that might influence what they do when they are pregnant and the decision-making process through the pregnancy. So I do talk to people a lot about testing, but it's also the implications of the results of those testing that they really need to think about, because that's that's a big thing.
And tell me a little bit about the timing that you're talking about. Are we talking about 2 weeks before you start? Are we talking about months before? What sort of?
I think it's always better if you have a little more time. Some testing takes a little time to come back. For instance, there's a test that we recommend called recessive gene testing, and the government currently is able to pay for a female to have the test done. It's a 3-gene screen looking for the 3 most common recessive gene conditions. The first is cystic fibrosis, the second is spinal muscular atrophy, and then Fragile X syndrome. So the government now is able to fund that, but it takes roughly 3 or 4 weeks to get that test result back. And should the female screen positive, then we would screen the partner as well.
But if the soon-to-be mum is positive and
Yes.
the dad's positive, then you have to have a different conversation.
Absolutely. And often we involve genetic counsellors to explain in detail what it would mean. There are different forms of the test in terms of the simple 3-gene test, and then there are expanded screening tests where you can do 300 to 600 different recessive gene types. They're much more expensive. They're not government funded, and some people just want to be armed with as much information as possible, but then they have to be aware that the more screening you do, unfortunately, you're more likely to come back with a positive result. So that changes the way we test as well. So we'll often recommend if couples want to do an expanded screening that they both do the test at the same time. That can take up to 6 weeks to come back.
So, Dr Jyoti, do many people come to you with this information before they're pregnant? Does it happen very often?
I think that it's happening more frequently, but I think unfortunately a lot of people are still in the dark when it comes to what's available to do even prior to pregnancy. So I think we know that the majority of pregnancies are actually not as well planned. So being armed with this information, I think, is very useful to a lot of couples, and it helps empower them during their journey through early pregnancy so that we can prepare them for the coming tests that are available.
And just what are the logistics of these tests that you refer? We're talking about all blood tests, is it saliva?
Also, some of the tests are blood tests and some of them can be saliva testing. So it just depends on the type of test, and most of the government-funded tests are all blood-based tests. And all of the antenatal screening tests, again, are all blood-based tests.
But nothing we've mentioned today is invasive.
Well, no, not more invasive than a blood test or a mouth swab. Definitely, if you're due for your pap smear, then that's something to get out of the way before you're pregnant. But a pap smear can actually also be performed very safely in pregnancy. So it's not something you have to get done before you're pregnant. If you're due during the pregnancy itself, then that can be safely done during the pregnancy. If you feel uncomfortable about it, we can delay it until afterwards. Just depends on your history.
Thanks very much, Dr Jyoti. Another episode
You're welcome.
down.
Yeah, fantastic.